Good morning, good afternoon, wherever you are. Welcome to our webinar. We're just going to give it a few minutes just for a few more people to come in. We'll give it maybe just a minute just to allow the last few people to come in. Okay, I think the numbers are slowing down, so it gives me a great pleasure to welcome you to our webinar today, Ending Vertical Transmission of Hepatitis B Through Testing in Antenatal Settings. My name is Rachel Halford and I am the President of the World Hepatitis Alliance. And this is really, I think this must be the first or one of the first events that we're doing ahead of World Hepatitis Testing Week, which starts on the 18th. So today is a webinar that we're delivering, and it is a panel discussion with an opportunity for you to ask some questions later on in the session. Before I go any further, I do need to thank Abbott because they funded this and which has made this amazing webinar possible. So thank you to Abbott. Just in case, if you haven't realised, I need to just point out that for those of you which are Spanish or French speaking, there is translation services available. And I believe there's a slide that will show us, here we go. So you can, to listen, you just need to select the original audio, which is on the bottom. I'm not the best at it. I think there is actually another, there we go. You can see the circle there. If you tap on there, for anyone who doesn't know, then you will be able to select the language that you'd like to hear the webinar in. Okay, before we begin, and the format is I should just do a really brief overview because what we really want is to have the discussion, really brief overview of hepatitis B and the mothers, and the importance of antenatal testing. And then we're going to have some discussion. We have three amazing and really interesting speakers with us today, and I'd really like to introduce them to you first before we do that, a little bit of presentation. So can I ask the other panelists to put their cameras on so that we can all say hello and introduce themselves? Here we go. So we have, here we go. So we are really fortunate to have Dr. Nadia, Aliyan and Louise Downs, who are in a room together, I think with a lot of people behind them, if that's right as well.
Hi, everyone. Yes, we are here in Kilifi in Kenya. It's quite late in the afternoon here. We've got lots of our people here, nurses and doctors who are responsible for antenatal testing here in Kilifi. My name's Louise Downs. I'm an infectious diseases doctor currently working in Kilifi. We've been doing some hepatitis B work here over the last couple of years with the expertise of Dr. Aliyan here. We're really pleased to be here. I'll pass over to Dr. Nadia to introduce herself.
Thank you for the introduction. Like she said, I'm a physician here, patron of the HIV and the hepatitis clinic within Kilifi County Hospital. And like we said earlier, we have a team behind us here who support antenatal care packages within Kilifi County. Thank you.
Welcome, and we are delighted that you can be with us today. Look forward to hearing from you a little bit later. And we also have Dr. Joshi, or as we say, Joshua, who's where are you from? I had it written down here and I've missed it. I know, I'm so sorry. Would you like to introduce yourself?
Hello, everyone. I'm Joshua Pacaira, volunteer member and officer of the Yellow Warrior Society here in the Philippines since 2019. And I'm currently working as community organizer for the Community Health Development Program under our state university. Nice to meet you all. And so I'm so excited to be here to share that. I hope it will be helpful.
It's lovely to have you here with us also. And I'm so sorry. Of course, it's the Yellow Warriors. How could I forget? A really, really well-known organisation. And our final speaker, which we're really delighted to have, is the Honourable Fawzia Khan, who is a parliamentarian. Would you like to introduce yourself? Oops.
I'm Dr. Fawzia Khan, and I'm from India. I'm a member of parliament in the Rajya Sabha here, which is the upper house. So good to be with all of you.
Fantastic. And thank you so much for being with us, because I know that you are super busy today. So I'm just going to provide you just with a really brief overview to set the scene of hepatitis B testing in antenatal settings. The next slide, please, Alexandra. And much of this information, I think you're all going to know, but I think it's important to set the scene. So there's over 254 million people are living with chronic hepatitis B worldwide, and about 1 million people die every year as a result of living with the disease. Every day, pregnant women living with hepatitis B unknowingly pass the virus on to their babies. Without prevention measures, 90% of babies born to hepatitis B positive mothers develop chronic hepatitis B infection. Next slide, please. Ending mother-to-child transmission is key to hepatitis elimination. Achieving elimination of hepatitis B requires a 90% reduction of new infections, and without addressing the mother-to-child transmission of hepatitis B, the main route for hepatitis B transmission, elimination will stay far, far out of reach. The first step to achieving this is to test all pregnant women with for hepatitis B as part of routine antenatal services. Women living with hepatitis B can then be linked to care and their babies vaccinated against hepatitis B, which is safe, effective, and affordable. It's senseless that this is not happening across the world already. Next slide, please. Only 13% of people living with chronic hepatitis B have been diagnosed, and 45% of newborns receive the hepatitis B birth dose vaccine within 24 hours of birth. Testing in antenatal settings is a window of opportunity. It's that has to be taken up to test mothers, partners, and families for hepatitis B who otherwise would not be tested. It also provides the opportunity to treat women living with hepatitis B and vaccinate those who test negative. Babies can receive a birth dose of hepatitis B vaccine within 24 hours of birth. Next slide, please. So to guide women through hepatitis B in pregnancy, the World Hepatitis Alliance has updated the NOhep Mums material, including 2 versions of the hepatitis B in pregnancy flyer, and these can be seen on the slide. One for mothers and their families, and one for healthcare professionals. These flyers reflect the new WHO hepatitis B guidelines and outline the steps to adequate care for expectant mothers and protect their babies. The flyers can be accessed as a PDF or viewed in your browser, which can be translated into local languages. So you just need to go onto the website, the NOhep website, and you can download these materials. Next slide, please. That's my overview, I actually think. Is that it, Alexandra?
That's the last one.
That's the last one. Brilliant. Okay, so that's just setting the scene, because actually what we really want to hear is to hear from our panelists. And we have a few questions, which I think everybody's already, you've got a bit of an idea, so it's no kind of rude awakening with strange questions. So we're going to spend a bit of time going through some questions. If you've got questions as the panelists are speaking, please pop them into the chat box. There will be an opportunity after the panelists have had their discussion for you to ask questions. You can put your hand up. We can't put your screens on, but we can put your mics on, or you can put them into the chat box and I can ask on your behalf. So I'm going to start first of all with Joshi. So maybe Joshi, if you could tell us a bit, what does prevention of mother-to-child transmission of hepatitis B mean to you?
As a mother, it's very vital to make sure that I protect my child from any diseases and illnesses. And as a patient, it's important that nobody will experience what I have been through having a viral hepatitis. And as an advocate, it's my calling to end the discrimination and stigma through preventive measures that can help to end viral hepatitis by preventing additional cases. And this webinar is well timed because here in our country, in my country, Philippines, the number one transmission for viral hepatitis is from mother to child. That's why the initiative in preventions starts from the womb and so on.
Thank you. That's amazing. And what's the role of civil society, you know, particularly from your perspective and the community-based organisations in improving access to hepatitis B testing for pregnant women?
Having community with different thoughts and real-life experience makes a big impact, especially in relaying the information of screening before the birth of their child. Telling a real-life experience so the mother as well as her support system will see through the needs and ways of preventing hepatitis B for the child and their family. Given with that knowledge, there will be a voluntary search for services. Also, having a community with experience who experience the cause of hepatitis, a community-based organization like us, the Yellow Warrior Society, can contribute to a patient-centered model of care and a specific problem solution that might be overseen, but has a vital role in creating more effective programs in improving access to testing and screening.
Yeah, it's so important, you know, the role of civil society and the community and working with clinicians and practitioners is so important. So how do you think we can improve the awareness of the importance of testing pregnant women for hepatitis B?
We already have a lot of well-informed IEC materials and information is already available online when it comes to importance of every early detection of viral hepatitis. So what we need to do is be consistent in disseminating information, making sure that the information is enough and true. We can do that by creating a community-based approach wherein we engage all sectors of the community to widen the program.
Yeah, brilliant. Thank you. But I think what's really important is, and we know this about hepatitis B and hepatitis C, it's about working in partnership. And that nicely brings me on to Louise and Dr. Nadia. So I guess the questions for you first, Louise, how did you set up and how have you set up and delivered hepatitis B testing in Kilifi County Hospital?
Thanks, Rachel. Yeah, so when I first heard about the webinar, as my previous speaker said, it was very well timed because we've been having a lot of discussion here about antenatal testing. But my background really is I came here a couple of years ago to set up hepatitis B testing among adults who were coming to Kilifi County Hospital for care. There was really very little testing before I arrived. I came as part of a research study. But as time's gone on, I've really realized that there's a much greater need than just within a research study. So we've been really working with the team here to try and get the testing up and running a bit more consistently. I think the things that have been really important with setting up the program here is firstly, a very good relationship with the team here. So the nursing staff, the doctors, all the support staff has been really vital in making the program successful. And also making sure that you give really good education to people, not only the healthcare workers, so they understand the importance of offering the testing, but also really critically is the patients or the people that you want to aim the testing at. So we did 3 times a week, we were doing health information giving sessions in the local languages here to people who were waiting in the hospital for other reasons and inviting them to come for hepatitis testing. So trying to make them understand the need, that it was a quick test, that we could do a point of care test there and then, and that there was care for them to support them if they were diagnosed. So I think sort of those are the sort of 3 things really that have made a big difference is support within the hospital, a good relationship with the staff, education giving both to staff and to the patients critically, and then just making sure that there's a follow-up procedure for people that are diagnosed.
Fantastic. That's brilliant. I know there's a couple more questions to ask you, but I wondered if I could bring Dr. Nadia in, just to, maybe what have been some of the barriers to providing antenatal testing in Kilifi? Because Louise has come in and this program's now flying and running, but what have been some of the barriers prior to that?
Thank you very much for having me here. Actually, despite that, the prevalence of hepatitis B in itself is quite high. I mean, we projected about 9% in some parts of Kenya. Yet, if you look into it, the number of mothers who get screened is very, very low. And I think the most rampant reason is actually a lack of awareness amongst healthcare providers. We're not really familiar with the current guidelines. We have a package guideline that says hepatitis B is part of the screening, but we're actually not doing that. And sadly enough, it's because hepatitis B virus testing in itself was not embodied into the ANC package the way HIV and syphilis was done. It's reached a point where it's a recommended test. It's not a compulsory test. Where in a way, if a patient needed that test, it would be an out-of-pocket payment. So these together actually, put in barriers. And why would I actually go out of pocket to do this particular test? Furthermore, we have got a lot of changes recently in the government, and we had a free package that previously didn't include hepatitis. And as much as we wanted to include it, we find that we've even lost basic tests that were being done before, like HIV and syphilis. So a lot of awareness is actually missing. And lastly, perhaps is an assumption also that maybe mothers are, not positive. Maybe this cohort doesn't need to be tested. So assumption, awareness, a lot of that are the main barriers to why we're not getting them tested.
And is there an involvement of civil society, or is this all clinician kind of researcher led?
Well, a lot of it, I would say, is research and clinicians, but they are disconnected, mainly HIV. HIV is driving the momentum in terms of testing. There are smaller societies that I think the impetus here is to join hands and do it together, because we speak louder when we're doing it together.
I love that. I mean, absolutely, we love that, because that has to be the mantra, doesn't it? But I guess what concerns me is, you say out-of-pocket expenses. So this is really important. You have this opportunity to test pregnant women. There are, I think you said just now there's an assumption that it's not a problem. We know it is. The data tells us it is. People dying tells us it is. So how do we, I guess there's something about, I'm slipping away from the questions there, so I am going wild on this, but how do we get it prioritized, and how do we get it funded then, so that people can afford it?
A lot of lobbying, I think, on our part, is a lot of lobbying to bring up the statistics, to actually say that a study was done somewhere, and this is the prevalence of hepatitis B in this population. In fact, if we compare HIV and hepatitis B, we'd be surprised that the prevalence of hepatitis B in the pregnant mothers might be a lot higher than HIV over the last 4 or 5 years. So that kind of statistics really gives us impetus to lobby in political spaces, mainly.
Yeah, and I guess I'm going to come back to you all, but I wonder if it's a good time to bring in Fauzia, and maybe, you're a parliamentarian. I can't speak today, sorry, you're a parliamentarian. What can you tell us a little bit about, because I don't think this is unique to Kilifi or to Kenya. What's the current access to hepatitis B screening for pregnant women in your country? You're on mute.
Yeah. So actually, India has progressively expanded hepatitis B screening as part of its national viral hepatitis control program, aiming to increase access, especially among pregnant women, through integration into existing antenatal care services and public health facilities. But of course, there have been challenges in rural outreach. While urban centers and public hospitals have screening facilities, rural and remote areas face challenges due to limited resources and awareness. Strengthening this rural outreach remains critical to improving equitable access to all pregnant women. even in places where health centers are available, it is critical that women actually go to an institution for delivery and immunization. This responsibility in India rests with the ASHA worker and the Anganwadi worker. So it's a beautiful system which is carried out in especially rural India. We have cost-free screening. The government has implemented free hepatitis B screening in government hospitals, making it accessible to pregnant women in the public health sector, which serves a large segment of the population. And there is progress in awareness. Recent public health initiatives, including community health campaigns, have focused on increasing awareness among pregnant women about the importance of hepatitis B testing to reduce vertical transmission risks.
So if it's free screening, is it free access to treatment, to vaccination,
Yes,
free vaccination? Yes. Okay. Yes. And I think this is a really important point because, you know, unfortunately, in lots of other countries across the world, it's about the expense. And, you know, it's about how, you know, vaccination in theory is relatively cheap because the World Health Organization has organized that. But actually, the cost of vaccination in countries isn't cheap, and that they aren't necessarily securing the prices that they should. Can I just ask you one more question, Fazia? So how has hepatitis B testing been integrated into triple elimination efforts in your country, in India?
Yes, India's health policy aligns hepatitis B screening with its commitment to triple elimination. That is HIV, hepatitis B, and syphilis under the broader antenatal care framework, reflecting a holistic approach to maternal and child health. And also, hepatitis B testing has been integrated with routine HIV and syphilis screenings in antenatal care, ensuring simultaneous testing for multiple infections and reduced missed opportunities for early diagnosis. Pregnant women who test positive receive guidance on neonatal immunoprophylaxis to prevent mother-to-child transmission. Yeah. India's immunization programs include the hepatitis B vaccine for infants, complementing efforts to prevent infection from birth. Also, there have been digital health initiatives. Through digital health systems like the Reproductive and Child Health Portal, India is tracking the screening outcomes of hepatitis B antenatal care, which helps monitor and enhance proper effectiveness, program effectiveness.
Fantastic, thank you. I mean, I guess I go back to Joshi, Louise, and Nadia. When you hear about all this free access and it's been signed off by the government, how does that resonate with you guys? Does it? Because for me, it doesn't sound fair. That, you know, there's one country. I mean, I'm in the UK. I mean, I have the most privileged system ever. I'm here, you know, where everything is free and its antenatal testing it's embedded and has been for a long time, as has vaccination. There's a really big battle, I guess. How do we support, or what do we need to do to support you guys? Or, I mean, it's just, I mean, I don't know another word apart from unfair, because it's really unfair. What do you guys think? I mean, in terms of how we can support, or how you move things forward in Kilifi?
Oh, I mean, hearing that makes me feel very frustrated, actually, because we know that it's a problem, and there are movements in Kenya for sure. So I'm in contact with the Ministry of Health about their kind of putting together new viral hepatitis elimination guidelines, and there's a team there that are really enthusiastic about it. They're a small team, but they are making steps. But the trouble is trying to disseminate it from, you know, sort of Nairobi, the central west of Kenya, out to the coast, I think will take time. And in the meantime, there's people that are transmitting hepatitis B and becoming unwell from hepatitis B because they haven't had a test, and therefore they're not on treatment. I mean, in terms of how we move forward, as Dr. Nadia has said already, I think we're stronger together. We're trying to create sort of an advocacy group with the Ministry of Health team. We're sort of trying to put together a group of patient advocates to try and create a national sort of patient advocate group. But first of all, there's not that many people that are diagnosed. So trying to get a group of people that are willing to come forward and speak, it's not easy. You know, it's a hard thing to do. But I think that's the way it has to come from the patients. I think they're the loudest, most strongest voice for advocating for hepatitis B care. And obviously we as the care providers will support them and provide information and educate people. But if we can get that patient voice out there, I think that it's really the best way to do it.
And I guess going back to you, Joshi, it's stigma. Stigma plays a huge part in this because of ignorance and lack of understanding around viral hepatitis, you know, and this association with injecting drug use or other behaviors. There's a real stigma around hepatitis B. I mean, you must see that in the Philippines as well.
Yes, yes, even in the patient themselves, they were the ones that don't know the right information regarding the hepatitis. That's why our focus until now, even though it's very a long time that we focus on the dissemination of right information, it's still the discrimination and stigma is the very big problem here in the Philippines. And without the passing the law in regards of anti-discrimination, I guess it won't stop, especially in the work in finding a work on the working. That is where the stigma relay on here in the Philippines. And after the antenatal test, we are trying to convince the mother, the pregnant woman here, to test, because he's here in the Philippines. The testing for viral hepatitis, the screening for viral hepatitis, is not included in the maternal package, health package in our government health insurance. So you have to pay it, and it's very expensive here, which is very expensive for those economically disadvantaged. So most of the pregnant women here, they don't undergo screening, and they don't know that they have the hepatitis B, even though it's a routine exam, laboratory exam requested by the OB/GYN physicians.
Yeah, absolutely. I guess maybe there was another question here that I didn't ask Louise and Dr. Nadia, which I think might be really nice. You know, what's your experience of testing families and working with families with hepatitis B or for hepatitis B? What's your experience of that? What's the real on the ground? What's it like?
I mean, as part of our study here, we tested a lot of family contacts of people that were diagnosed with hepatitis B. And generally, people were really supportive. Lots of people brought their whole family with them for testing.
Yeah.
I mean, talking 20 people at a time. But it was really nice because, well, if there was a cluster in a family that were diagnosed, they were all really supportive of each other. And I think it kind of gave a ready-made kind of peer support group, really. But in the same way, it was also quite upsetting and alarming to see the numbers of people in one family that would be all positive. So we'd have, 5 siblings of one family that now lived apart, but when they, as young children and babies, they lived together, and, they were all positive. And sometimes the mothers were positive as well, and sometimes the mothers were actually negative. So there's definitely some possibility of transmission within households, both from mother to child and other means. So I found that quite shocking, actually, the numbers in family groups that were all co-infected. But it was good bringing them together and bringing them all for information giving, all for support within kind of the same group. I thought was, it worked really well, and people were really supportive of it.
And did it encourage more pregnant women to be tested? I mean, Dr. Nadine, is there more enthusiasm having done this piece of work, that Louise has done this work? Does it really highlight the need in Kilifi to do the antenatal testing, to do the vaccination, to get access to the vaccinations?
Actually, what Louise has really done she's created a hunger right
Yeah.
now.
Yeah, I can see that.
Yes, so I actually anticipate a very positive uptake. And as much, I also resonate with the Yellow Warriors in terms of testing and finances, but then we have the advantage of the test being slightly more reasonable. I mean, at 200 shillings, I think that would be
about $1.50.
Yes. So $1 is a lot, but then we need to come out of that inertia and say, for those who can afford it, let's recommend the testing to be done. So what has been created here is a hunger, a need for us to do the testing for those who can actually afford it. And it's rolling right now for those who can do it.
Amazing. And what about the vaccination? If a mother tests positive, are you able to do the vaccinations then?
Yeah, so the vaccination, Louis will build upon. I'll talk about the pediatric. We have an immunization schedule. We're struggling with the vaccination within 24 hours. The immunization schedule is programmed at weekly schedules for the babies, even if they test positive. But Louis has a better background in terms of.
I mean, it's similar to what Dr. Nadia has said. There is currently no provision for birth dose vaccination within sort of government hospitals in Kenya. It's kind of on the schedule of the new guidelines, but I think vaccine access is a big problem. Affordable vaccine access is a big problem. Even we vaccinated as part of our study the close family contacts who tested negative. We vaccinated them, but we struggled to find them at an affordable price. Trying to get the multi-dose vials of vaccine was very difficult. And we've also been running healthcare worker vaccination program here, which again has been challenging to access the vaccine. So I think finances are definitely a problem. And I think similarly awareness, trying to find good evidence to show the people in charge that the birth dose vaccine is effective. I think there are still some barriers here that we haven't overcome.
Okay, and do you know if Kenya accesses the Gavi vaccine program?
I think they have been. I think it comes to an end in the next 2 or 3 years. But they have been accessing up till now.
Yeah, because that's a real concern. I wonder, Fauzia, how is it for you hearing the difficulties in Kenya and the Philippines when you know that you have I mean, what would you recommend that we are saying to the governments, to the other governments, because you obviously have moved forward and you have this access to everything and you have it's funded by the government. What is it like to hear about how difficult it is in Kenya and the Philippines?
See, finally, it is the outcome that is important. In India, in spite of all the efforts and the free privileges that are being provided, the outcomes are still not as good as they should be.
Okay.
So I think basically it's the awareness. And for this, we as parliamentarians and public health leaders can advocate for policies that mandate routine hepatitis B screening in both public and private antenatal services, building on existing frameworks for communicable disease screening in maternal health. So I think this is very important, that we leverage media and grassroots programs. Policymakers can initiate awareness programs targeting high-risk groups, highlighting the importance of hepatitis B screening during pregnancy to prevent vertical transmission and ensure healthier outcomes for both mothers and infants. So all these initiatives are very, very important. We need to train healthcare providers and midwives in rural and urban settings both about the significance of hepatitis B screening. This will ensure consistent advocacy and encouragement during antenatal visits, reinforcing the message of the impact of screening on maternal and child health.
Yeah.
So I think these are some of the initiatives which are very important if we feel that outcomes have to be there.
Yeah, I think that's a really important point that, you know, even with access, you're still not seeing the outcomes. And I guess that brings us back to why we're doing this World Hepatitis Testing Week, because part of it is about raising awareness. I really feel for Louise and Nadia. I just need to say this, it looks very hot in that room and you have the sun in your eyes. And I'm so sorry for both of you. I wondered if, yeah, really poignant that this is what we're doing now to raise awareness. Shall we see if there are any questions from the audience? Because we do have 55 people in the webinar, and I know that you have some people behind you, Louise, as well. So is there anyone in the audience who might like to ask a question to the panelists? Or you can put something in the chat box, or if you don't want to ask a question, you might like to share what's happening in your country or some of the difficulties that you face. Or you might have actually addressed a difficulty and you might have some advice on how to change something. I can't actually see if any hands go up, so we're reliant on Alexandra to let us know.
We have a question in the room here in Kilifi, if
Oh,
that's
yes,
okay.
please. Yes, please.
Question in terms of if a positive baby born of a hepatitis B positive mother, what's the role in immunoglobulin, hepatitis B immunoglobulin? Because I found out the hard way that a vial costs around 24,000 here, and most of them can't afford. And I see on your pamphlet, you just sort of like recommend it. It's not necessary. I don't know if how effective it is, and is it really necessary to buy, because most of them can't afford it.
Is this the information that came off the new guide,
On the website?
Yeah. So this is information from the WHO new guidelines. So I'm not a scientist or a clinical, so I can't give you exact information around that. But what I can say is these are the recommendations from WHO that are in the new guidelines.
Can I help answer that?
Yes,
if
I was
that's
going to say, I mean, it's scientifically, you may be able to, Louise sat next to you will probably be able to answer that better than I can, unless anybody else, or Carrie's got his hand up as well. Do you want to go, Louise, first?
I'll let Carrie speak. You know, he's an expert
Carrie.
here.
I'm not sure. I'm sure you're more of an expert than me. Hi, everyone. I think the general position, and according to the guidelines, is HB, if possible, if affordable, is a good kind of booster for birth dose vaccine. But because of the points that you just pointed out, the cost barrier of it, it's not actually part of the main algorithm for prevention of mother-child transmission. So I think if it's available and affordable, then absolutely. But if it's not, then the regular algorithm is recommended. Maybe I'll just be quiet there. I don't know if I explained that very well, so I'll hand over to you, Luis.
It's okay. Thank you.
Yeah.
Does that help? Sorry. I mean, it's not, yeah. Okay. Okay. Are there any more questions from the room? Or any questions online? Has anyone got their hand up? No. I guess, I mean,
I think
yes, we
sorry,
do.
Rachel, I think we've got another question in the room here. Oh, and another question online.
Yeah, we have
sorry.
got, oh, brilliant, brilliant. Hello. So shall we go? We'll go to you, to the room first, and then we'll come back to you, Wabito. So yes.
Yes, so my name is Mary. I am a nurse working in the maternal and child health clinic.
Hi, Mary.
Yes, hi. During my area of practice, I've interacted with women, and I must say that we have really put emphasis on in the three components of the triple elimination. We have really made some strides as far as HIV is concerned. I would say we are at 100% testing, and syphilis as well, we are at 100% testing. However, the hepatitis B part is what is lagging behind. And as Dr. Nadia and Dr. Louis have mentioned, we're having a challenge when it comes to affordability of the test. However, we have opted to create more awareness and tell the mothers that this is important. And if you miss out on it, and probably you're hepatitis B positive, these are the possible consequences. And we are hoping that that will bear fruit. So advocacy is what we are working on right now.
Yeah, it's so important. I mean, and I guess, you know, because, you know, it's the power of the voice, isn't it? And it's the power of the group together. And if you think about what, you know, we started this whole journey on eliminating viral hepatitis, it was the patients who lobbied WHO for the resolutions, you know, so we know it's possible. I think this is we just have to, you know, not lose faith and keep fighting and keep shouting. There was one other question. Thank you for that. Was it Wabito? Am I pronouncing that right? Did you have a question or a comment?
Yes, hello, good morning.
Hi, good morning. Sorry, how did I pronounce your name right?
You did it very well. It's called Wabito, yes.
Wabito, okay.
Thank you very much. I must say thanks to the hard work you're doing for organizing such a good webinar. My support comment here is I see we're emphasizing on advocacy, which I really want to also throw light on. But in the aspect I'm coming from Sierra Leone, and I know there is some level of awareness going on, but I think one of the challenges we're having is how can we translate a lot of the health message into local dialects, because like Sierra Leone, for instance, has 16 ethnic groups. So how can we translate a lot of the health message into local ethnic group languages so that people who are down there in their villages can better understand the importance of screening for very infectious disease like hepatitis B, you know, and I believe understanding the health message in one's own language, that might help to change the belief system and give people a confidence about the need to cooperate with established health authorities, and as well as to be able to get a positive outcome. I'm very much interested in this area. In fact, my undergraduate research degree, research project was on hepatitis B. So I was looking at investigating the prevalence of hepatitis B among blood donors in Sierra Leone. And I know hepatitis B is a very serious problem for us. So I just wanted to ask, how can WHO and other organizations really see that most of the health messages are being transformed into the local dialects so that people in their native tongues can better understand, and even healthcare workers too can be trained in some of these areas and then be able to better help persons understand and help with behavior change as well as proper cooperation. Thank you.
Thank you. I mean, how do you, I mean, Dr. Nadine or Joshua, you know, language, you know, I mean, I think it's a really valid point. You know, we need to, for most people, in fact, I would say for everybody, hearing information in your own dialect is so important. How do you address it, or do you have the same issue?
Yes, we have the same issue. As you know, the Philippines has a lot of local dialects. So what we do, like as the Yellow Warrior Society, we create chapters,
Yeah.
chapters that in different provinces, which is the one that the member on the provinces will, the IEC material, they will translate it on their languages. Then we visit those provinces to let them know more about the IEC materials.
Yeah, okay. Dr. Nadia, and then Carrie's got his hand up because I know he's going to talk about the materials that the Alliance translates. But how do you cope with all the different dialects?
Well, generally easier for us because the two main languages are English and Swahili. So
Oh, wow, so much easier.
yeah, so during the time when Lois was with us, we just made sure we had a Swahili speaker with us who would translate the messages from English to Swahili. And I would say easier within Kilifi because those are the main languages.
Yeah. And Carrie, did you want to say something about the materials that the Alliance has?
Can you hear me?
Yes, we can.
Sorry. All right. Brilliant. I mean, I think to a large extent, we really rely on our, partners in country or in specific areas to identify those needs and help with, those translations. And I think the Alliance has always been very open about if there are resources that we have that aren't available in the language that you need, that we can help, create new resources in the appropriate languages. That said, we do provide translated resources in 7 different languages on the website, and also an online tool where you can choose the language that you want the resource to be translated into. You can choose a photograph that's appropriate to your community, and then create a PDF that could then be printed or used locally. And also all of the information that's available on WHA websites does have a Google Translate function, which does translate into many, many, many languages. So I think, appropriate language is something that we take very seriously. And if there's anything that we have that, you would like to have translated, please let us know, and we'll work with you to make sure we can make it available in the language that you need. Thanks.
Absolutely. Thank you, Carrie. We're getting closer to the end of time, but there's a comment that's come up, which I think is really important in the chat. And this is from Tulari Tyne in Nigeria. So hepatitis B, both doses are provided, but they are provided during antenatal days in health facilities. Women who give birth outside health facilities will have to wait till the clinic days. The vaccines may not be available and may not be accessible. And I think that we haven't really touched on that, of what happens for women who, we've only talked about clinics in hospitals or in permanent settings, but there's something about what about the outreach, and maybe I think we've got about 10 minutes left. I mean, I don't know, maybe it'd be good to hear a little bit more about your views on outreach. So maybe from each of you, kind of taking the services to the people rather than people coming to clinics. I don't know, what do you think? So Louise and Dr. Nadia, should we start with you?
Yeah, this is a really good point, and it's something that I'm really enthusiastic about, because we have most of our Hep B care is done here at the County Referral Hospital. There are some peripheral clinics sort of up and down the road, but not many. And a lot of the feedback we've had from our patients is that they would like the clinics to be taken out to the communities so they can come, they can get their medication, see a doctor if they need, and then go. A lot of the problem is they travel from a long way. It costs money to get the transport, and then they have to wait at the clinic for some hours because the clinic's very busy to get their medication. So it's definitely something that we're looking at, is how we can provide more care that's outside of the kind of central hub. And I think that's a really critical piece in the kind of puzzle of how to get the hepatitis B care out there to the people.
I think just to add on that, we have the universal healthcare program that's rolling out in Kenya right now. So this is actually the right time to make this kind of noise now, so that we get this outreach done as part of the program. It's grassroots first. They don't have to come to tertiary facilities to be tested or to get their medications. They can get it at the facility that's nearest to them. So it's the right time to make this noise.
I love that, grassroots first. I think that's a really good slogan. Really good, I really do like that. Fazia, for you, what about the, kind of people who are outside clinics, the outreach, those in rural settings? We've got a new screen,
I'm
but
sorry, yeah, I could unmute now.
Yes.
See, I think it's a very, very valid issue, because if people are not able to go to institutions and those institutions don't have the necessary facility, all the awareness comes to nothing. So we need to coax our governments to direct more funding towards hepatitis B awareness and screening programs, and to strengthen their infrastructure, particularly in underserved areas, so that we ensure that the message of hepatitis elimination is widespread and services are well resourced. For instance, in India, in rural areas, we have these quack doctors. Now, these quack doctors are not very conscious about sterilization of their injectables. So when women become aware, obviously they will be questioning these quack doctors. They will acquire awareness. And through this little, being conscious about making sure that whatever injectable is given is actually sterilized. So that can make a big difference in curbing the spread. So all these issues, I think, are important, and particularly institutionalized deliveries are important, because the point here is so valid that if it is just antenatal, then we are not getting the right outcome. It has to be prenatal. And for prenatal, we need to have a system. And I think our governments should take some lead in this area.
Yeah, I think you're absolutely right, but I do think that it's going to take a lot of lobbying from community. So, and Joshi, what about, in the Philippines, the work that you guys do, the outreach, because as we've just said, not every, there are many women giving birth outside of antenatal clinics or outside of antenatal services.
I think lobbying is very important.
Yeah.
To lobby when such issues are there. So this is what we are all there for.
Yeah, no, I 100% agree. But I think there needs to be a unified, strong voice around this.
Absolutely true. Yes.
Yeah. Joshua, any final kind of comments around that work outside of the actual traditional healthcare settings and messaging perhaps, or treatment?
First, my message, the patient and the government should understand their accountability in seeking medical services. Then, because the problem is same with the other country, and that's the part that need the improvement. So we should know that we should have a community-based forum to hear the different stakeholder insight regarding of current hepatitis testing in antenatal care in different settings. So letting them know that the importance of each other initiative to seek and provide services.
Yeah, I think that's a really important point. We've got 8 minutes left. We're fine. We're absolutely fine. I just wondered, do you think there's value in us coming together more as a group, really focusing in on, I know we have, the Alliance has NOhep Mums, but I wonder if there's something about more regularity to keep it on the agenda. I think that, we globally, we don't have many years to go until 2030, and even if some countries are making it a bit further forward with hepatitis C, my concern is, I think all of our concerns is hepatitis B is a bit further behind than hepatitis C, and hepatitis C is not in a good place. So I wonder if there's something about us coming together more regularly, to maybe hear from each other, but also to garner ideas, because for each of us, I think we have to hear about something that's happening somewhere else so that we can go to our government and say, right, we're lobbying for this now because we know in other countries this is happening, or to get support from other countries. Today I was in a meeting and I was hearing about Egypt supporting another country, with treatment, access to treatment of hepatitis C. Is it about us working together more collaboratively, both in terms of finance and best practice models? I don't know. I'm just going to put it out there for you guys. Do you think we should meet more often and perhaps form a stronger voice?
I genuinely feel we should be meeting more, and we should be standing up for all the women of the world together and help each other, collaborate.
Yeah, yeah. Go on, Louise.
No, I can say I totally agree. I think these kind of events are so important, just to remind everyone that we're all working towards the same thing. And as you say, to take ideas from other people, listening to India makes me really even more strongly want to advocate for testing here. It makes me frustrated, but also gives me passion to keep it going.
The saying
Thank
is
you.
you can go faster alone, but you go further when you're together. So yes.
Absolutely. Yeah, absolutely. Joshua, I can see you starting to go. This is your mantra as well, isn't it? It's together.
Yeah, collaborating with different stakeholders is very important to a patient like us, because that's the way we understand what is the challenges between the healthcare workers, the government. Because as a patient, we know our situation, our problem, so we focus on there. So giving the joining webinar like this, or joining different session with other stakeholder, make us open to understand them why the situation is like this. So thank you for inviting me here.
Oh, no, thank you for being here. I guess the thing I keep coming back to is parliamentarians, and thank you, Fazia, for being here with us today. But, we need parliamentarian representation from all the countries, that we need to have them all on side, because, you're quite unique. I'm not sure that there are many, across Africa, definitely, there are not many health ministers, and I don't think I'm wrong in saying that they are so supportive in the same way. I don't know, what's it like in Kenya? There is more support because you have some programs and you have this new health, universal health coming now, but is that enough?
I think it's a good start. I
Yes.
mean,
Yeah.
The intentions are in the right place. Maybe not having the infrastructure for it yet, but I would say rather than poking at what they should be doing, I would focus on us as healthcare providers, because that's where I'm speaking at now. Are we aware enough? Can we beat the clinical inertia we are at right now, so that when the parliamentarians do their part, we should also step up? It takes together again.
Okay, so are you saying that but don't you need one to happen with the other? Because healthcare workers might not have the awareness if it's not coming down from the top. So don't you need them both to be going at the same time?
True, I agree with you, but I would speak in the perspective of when the test is available at the subsidized rate it is, are we using it to the best capacity? So that you actually have a voice out there, say, at 200 shillings, I was able to do it for 50 people, but if we subsidize it or make it free, I'll do it for 100 people. So if we play a role there.
Yeah,
That's
no,
right.
I understand, and I hear you. So we have 3 minutes left. Final words from all of you. I'm going to say, I just want to say thank you so much. I feel like we've only just started feels like we need another however many sessions, or maybe not hours now, but this is just the beginning. I haven't been involved in many conversations, and it makes me realize there aren't enough conversations going on. So I want to say thank you, from the bottom of my heart, to all of you for representing women, and for mothers, and the testing and treatment for hepatitis B and vaccination. But final words from each of you. Where should we start? Joshi, do you want to have last words from you?
Well, again, thank you for inviting us and making us feel that nothing about us is without us. So again, thank you for collaborating, for inviting the patient, especially here in the Philippines. Thank you, guys.
Thank you. Fauza, last words from you?
Yeah, I can only say thank you for kindling that spark in my heart. So, we all feel passionate now that we should be doing something, and we should destigmatize whatever there is a stigma about. I think this destigmatization is going to help us a lot in this long journey. But let's make a beginning.
Yeah, absolutely. And Louise and Nadia, last words from you?
I mean, just to echo what everyone else has said, I feel so strongly that this is a global travesty that we're not doing this already. It's our responsibility we need to get everyone on the same page, advocating for the same thing. And it's webinars like this that bring people together and keep us strong. So thank you.
No, thank you. Thank you all so much. Thank you for everybody who's attended today. A reminder, week beginning the 18th is the World Hepatitis Testing Week. A great opportunity to echo everything that you've heard today. And I guess, yeah, I mean, we need more of this. I mean, Carrie's here, I know. So, and the Alliance team are here. So I think we need to do more of this. And I'm with you and very committed with you as well. So thank you very much to everybody. I believe the recording will be available. Have a great day. I really want to let Kilifi, those in Kilifi go because it looks so hot there. It looks like they're melting, but thank you to everybody.
Come over for some sun.
Well, it's not nice here. Have a wonderful rest of the day, everybody. And I look forward to seeing you all again soon. Thank you very much.
Thank you very much. Bye.
Thank you. Bye-bye.